LGBTQI mental health. The lesbian, gay, bisexual, transgender, queer, questioning, intersexed, LGBTQI community represents a diverse range of identities and expressions of gender and sexual orientation. In addition to these identities, members of the community are diverse in terms of race, religion, ethnicity, nationality, and socioeconomic class. We produce 5 amazing videos on various topics per week, so click on the like button and subscribe to see future videos. Like, share, comment, subscribe. Important risk factors of LGBTQI mental health. Coming up. Positive changes in societal acceptance of LGBTQI people act as a protective factor for mental health. However, this shift in acceptance has meant that many LGBTQI youth come out or share their sexual orientation or gender identity at younger developmental ages, which can impact their social experiences and relationships. This can have negative mental health impacts, particularly for youth who are not in supportive environments. Rejection. For many of the LGBTQI community, coming out can be a difficult or even traumatic experience. It can be difficult to cope with rejection of something as personal as one's identity from family or close friends within the workplace or in a faith community. Trauma, homophobia, biphobia, transphobia, bullying, and feeling identity-based shame is often traumatic for people. Substance use. Substance misuse or overuse, which may be used as a coping mechanism or method of self-medication, is a significant concern for members of this community. LGBT adults are nearly twice as likely as heterosexual adults to experience a substance use disorder. Homelessness. It is estimated that LGBTQI youth and young adults have a 120% higher risk factor of experiencing homelessness, often the result of family rejection or discrimination based on gender identity or sexual orientation. This risk is especially high among Black LGBTQI youth. Suicide. Many people in this community struggle in silence and face worse health outcomes as a result. The LGBTQI population is at a higher risk than heterosexual cisgender population for suicidal thoughts and suicide attempts. High school students who identify as lesbian, gay, or bisexual are more than 4 times as likely to have attempted suicide compared to their heterosexual peers. 40% of transgender adults have attempted suicide in their lifetime, compared to less than 5% of the general U.S. population. Inadequate mental health care. The approach to sexual orientation and gender identity and mental health care often groups together anyone in the LGBTQI community when these communities are considered at all. This method can be problematic as each sub-community faces unique challenges, rates of mental illness, and experiences. How to find the right mental health professional. There are important considerations when seeking LGBTQI competent care. Here are a few steps to find a professional. Step 1. Think about what you're looking for. While considering the type of mental health professional you are looking for, it is important to consider the following. If you want a provider who shares specific parts of their identity with you, you may be able to find out if your provider is LGBTQ by reading their profiles or websites. If you are transgender and are seeking a mental health professional to write a letter of support for gender-affirming medical care or for legal documentation change, you may seek a provider who understands the insurance or legal requirements of support letters. Gather referrals. Many websites that provide mental health professional directory searches, including insurance company websites, have filters that allow you to show only mental health providers who have specialty or competency in working with LGBTQI patients. These directories, however, are not the only way to find LGBTQI competent providers. Many LGBTQI organizations and community groups provide directories that have been vetted by other LGBTQI people. You may want to check with local LGBTQI community centers, local LGBTQI health centers, LGBTQI community groups such as equality groups, health collectives, social organizations, support groups. Affirming places of worship. Make the call. Some people find it difficult to make an initial call to a mental health provider. Transgender people in particular may feel uncomfortable talking on the phone due to concerns about being misgendered due to their natural voice range. If you find you're reluctant to call, ask a friend or family member to call for you.